Hello and welcome everyone. Thank you so much for coming today. Today I'm going to talk for about the first 30 to 40 minutes around some recommendations and some resources for public health departments looking to contract with community-based organizations and community health worker networks. If you're not contracting right now or you don't have the funding available, we'll also talk about some partnership resources and maybe some tools and tricks to build partners. So before we begin today, my name is Aurora Grant Wingate. I work for the National Association of Community Health Workers, or NACHW as we say for short. I've worked there for about 3.5 years now as their member and partner engagement manager, and I'm a community health worker ally based out of Boston, Massachusetts. Just making sure people are let in. To get us going today, I do want to acknowledge our partners at NMPHI. This work that you're going to hear today is supported by funds made available from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services, National Center for STLT Public Health Infrastructure and Workforce, through Strengthening U.S. Public Health Infrastructure, Workforce, and Data Systems Grant. The contents of this presentation are those of us, NACHW, the authors, and do not necessarily represent the official views of nor an endorsement by CDC, HHS, or the U.S. government. This is really just some resources that NACHW has put together in partnership with NNPHI through what we know from some of the state health departments working on this big funding. To get us started today, we do like to run through some checkpoints. One, know that the meeting is being recorded, but if you want to stay off camera, you won't be captured in the recording. Please, to get us started, feel free to write your name and where you're coming from in the chat. We're a small group, so we can get to know one another. Please keep yourself on mute if you're not actively speaking, but at any time you have a question, please feel free to raise your hand or throw it in the chat. If during the presentation you have any technical issues, please let us know either in the chat or email info@notchwood.org. To get us started today, because I want to make sure that we are doing our best to make sure that this presentation is applicable for folks in the room, I do want to start us off with a quick poll. Let me get that started. This quick poll will really just show a little bit about some of the resources that NACHW offers. We want to know if folks are already familiar with those resources, or maybe they're all new. That's great, just so we can focus the presentation today. We'd also like to know a little bit of your familiarity with a CHW network. Some of you might already have really thriving partnerships. For other of you, it might be the first time you're hearing about that. Any of that is welcomed. It's just good for us to know sort of where folks are. So I launched that poll. I'll give that about a minute for folks to respond. And thank you. I see folks are starting to introduce themselves in the chat. Hello, Christian. Oh, see you're from Maryland. That's great. I know we have some other folks from across the country on. Oh, nice. Thank you. I see folks are starting to take the poll. We'll leave that up just for about a minute. Hello, Shelby. Oh, Shelby, it's nice to see you out in Kansas. Again, we're getting folks from across the country on today. Give it a few more minutes. Let's see, sort of last call for folks to answer some of those poll questions. Okay, I'm gonna end that poll. Share our results just as I sort of voice them over. It seems like some folks on the call have heard of a couple of our resources, our policy platform, are the CHW definition, but it seems like folks are sort of new to our resources, which is great. It's what I'll spend some time on today. It also looks like in terms of folks already being connected to their CHW network, one person says they've connected but haven't collaborated yet. And one says no, but would like an introduction. That's great. That's just what we're here to do today. Okay. So as a reminder, today we're going to talk a little bit about contracting and building partnerships with CBOs and CHW networks. One of the reasons that we're focusing sort of on this topic today is that we know from our partnership with NMPHI that some FIG recipients are sort of struggling with the hiring of community health workers. So hopefully since many recipients were unable to meet their year one hiring goals, we hope this webinar provides some tips and strategies for hiring and working with community-based organizations to bring on those CHWs. We also know that building relationships with CBOs and CHW networks can help build trust in the community. And also we're hoping to do all of this really through an equity lens. And sometimes equity takes time and it requires trying out some new strategies and finding what works for your community. But this is just a 1 hour presentation and there are so many tools out there. So I also hope that this serves as sort of an introduction and sort of a selection of some of the great tools that are out there on different topics around contracting and building partnerships. So the objectives of today is first to talk a little bit about NACHW as an organization and some of the resources we have around workforce development more broadly. I'll spend a little bit today continuing to talk about the importance of partnership with CBOs and CHW networks. And then I'll go and spend some time about some high-level recommendations for contracting and partnering. And then we'll end the presentation. We'll have some time for Q&A, and then I'll also share some opportunities to continue to engage with NACHW if you find these resources helpful. So starting with a little bit about us as an organization, NACHW, we're a pretty young organization. We were founded in April 2019 after many years of community health workers and allies working together to build the first centralized unifying organization for the profession to work on issues of professional development and capacity building, sustainability for the profession, and more. We really have a vision to see community health workers united nationally to support communities in achieving health, equity, and social justice. And we have recently started to develop some new language to talk about our approaches in this work that really uplifts and centers CHW's voices. One of those is to amplify the unique identities, qualities, competencies, and expertise of CHWs. To really work to articulate the past, present, and future of CHWs and their roles in social justice, to ally with individuals and organizations who share those values, and also to work to advance innovations in CHW workforce and research. And NACHW is increasingly also working to advocate for sustainable and equitable policies and funding for CHWs. And lastly, as a membership organization, we work to activate CHWs and allies across the country around this vision and this mission. As I said, NACHW was first and foremost a membership organization. We have members across the country and some of the US territories. Here you can just see a map of where we have some of the highest members across the country. We do look to sort of increase our membership and make sure that we have a representation of CHWs and CHW allies across the country to help influence our policy work, our benefits, and making sure that we're able to put together these recommendations and that they're representative of what's really happening. But we also want to take a step back and make sure that we're all sort of on the same page of who we're here to support. NACHW does use the APHA CHW section's definition of a community health worker, that they are a frontline public health worker who is a trusted member of or an unusually close understanding of the community that they serve as a link or intermediary between health and social services and the community, that they facilitate access to services. They often work in cultural competency of service delivery, and they build individual and community capacity of health knowledge. We also sometimes talk about how the term community health worker, or CHW, is an umbrella term of the many different job titles CHWs might have. And that includes most prominently promotora de salud, community health representative, or many other up to 100 different job titles. And we really work as an organization to lift up the voices of community health workers and give additional language to talking about and partnering with community health workers. Some of that is about the important data work that we do to make sure that we're accurately capturing what's happening with community health workers and who they are across the country. And then also, as I'll talk about a little later in the presentation, resources like the 6 pillars of community health workers to talk more and give additional language beyond the APHA definition of who community health workers are. We also want, before I dive into some of the recommendations we have around contracting and partnership, we want to make sure we're on sort of an equal playing field on sort of who are we talking about when we talk about community-based organizations and CHW networks. So community-based organizations operate at community or grassroots levels. They often serve specific communities or geographic areas, and they're really embedded within communities. They often hold really trusted positions and are often working to address social determinants of health. Through our research, NACHW has found that the majority of community health workers are actually working at community-based organizations. So it often becomes sort of synonymous with CHW voices. Many CBOs out there are actually CHW-led. And can be a really great partner and are already doing a lot of similar public health work. Then on the other hand, CHW networks or associations, we define them as organizations that are led or co-led by CHWs and whose identity and whose mission and activities focus on CHW membership, networking, policy advocacy, and workforce development. It's a little bit of one of those situations of square and rectangle. So many CHW networks are CBOs, but not all CBOs are necessarily CHW networks. Some of the benefits of working with CHW networks is some might be directly hiring CHWs, and they might even do some program management. Some of them do direct health service work within their organization. Many of them also work in data collection on the CHW workforce, and they do policy work. So they can make really great advisors to that work, and they can help design or sometimes do program evaluation of CHW programs. So they can offer some additional sort of perspective if you're already working with community health workers or looking to maybe improve your CHW program. And now again, because I want to make sure that the presentation today is really useful for the folks on the call, I would love if folks could use the chat and talk a little bit about what your experience is so far, either partnering or contracting with either CBOs or CHW networks and associations. And really, we're open to wherever folks are. If folks might have never contracted or worked with a CBO, that's totally fine and great. Or folks might be experiencing certain barriers, definitely want to help and see if there are ways we can address some of those today. Or if you're having issues sort of connecting with your CHW network, all of that is helpful to hear a little bit about. I'll give folks 1 minute. If folks don't want to share in the chat and they don't just want to listen today, that's also totally fine, but I'll give it 1 more minute. Okay, I will go ahead with the presentation. Again, as I'm talking, if folks have questions, feel free to throw that in the chat. Happy to hear a little bit more about what folks are working on. But here I'm going to start with some sort of high-level recommendations that to keep in mind when you're first looking to partner and contract with CBOs and CHW networks. Really what I'll do today is talk about some resources and websites that are out there to help sort of get you started. This won't necessarily be some exact contracting language, but I do have some tools, some examples that we'll share out both during the webinar, but also I will be sharing all of this out afterwards in an email to folks who have registered with these slides and resources, and eventually with a sort of full toolkit of all this work. So one of the things we often talk about is that CHWs really thrive working on social determinants of health. And we really recommend that folks include that as sort of a core part of contract deliverables. Often what we find is even when CHWs or CBOs are contracted to do something that's very disease specific or infectious disease specific, they end up doing a lot of social determinants of health work anyway. Here on the left, you can actually see a snapshot of some of our 2021 national data, talking about all the different organizations CHWs are working with. So CHWs are already doing a lot of cross-sectional work, and it can be really beneficial to allow them to continue doing that social determinant of health work that help address some of these upstream barriers for community. And here on the right, I have some resources that, again, we'll share out about how you can sort of put this into a contract. There is a great return on investment calculator from Health Begins that helps folks sort of make this case on why include social determinants of health sort of deliverables within maybe a contract that is COVID specific or another disease specific. And also some other language around the importance of community health workers and how they address social determinants of health by both the Connecticut Health Foundation and MHP Salud, both who sort of talk about CHW roles if you might be new to the CHW field and want to hear a little bit more about how that's sort of relevant. And here I want to talk a little bit about hiring authentic CHWs. That's something that we at NACHW talk about a lot, but sort of what does that mean and how does someone do that? So through the presentation today, we're sort of talking about contracting with CHW networks or CBOs to sort of hire CHWs. And we want to make sure that those contracts enable them to either retain the workforce they've already hired that are authentic CHWs, and that doesn't put any additional barriers on them hiring additional CHWs. Some of those barriers we often hear about is that perhaps folks have to unnecessarily provide paperwork in English, even if they're not providing services in English, or maybe there are other educational attainments that might not actually be relevant to the position that public health departments might include as part of a grant. And we know that whenever you're working with government money, there can be certain things you have to include in the contract. But I think whenever possible, thinking about ways that you can remove barriers and allow folks from the community to be hired to do this work. And here is something we call the 6 pillars of community health workers. This is some more language that sort of talks about who community health workers are. Again, if you're new to sort of talking about community health workers, here are some of the talking points that we often make, that it's a really unique field. It's, again, really uniquely community-based, and it's also historic and diverse with CHWs that can be traced back several decades and even hundreds of years. Really uniquely across sector workforce and a proven workforce with over 60 years of workforce studies, but is also unfortunately sort of a precarious field. And a lot of that is because of some of these barriers that we see come up in hiring, that folks put up certain barriers for authentic CHWs to be hired. Another great resource that we want to give to folks is to sort of lift up the CHW Core Consensus Project. The reason this is important is because we really recommend that CHW are able to work to their sort of full scope. So when putting together contracts with community-based organizations, we want to make sure that CHWs aren't just working in data collection. They're not just sort of doing some limited health education, but that there are really more that community health workers can do. The CHW Core Consensus Project is something that has been developed over many years, where they've really looked across the country of what are all the roles and competencies that CHWs provide across the country. And this can be a really great starting place for folks to really understand what else community health workers can do and what else they can take on as part of these contracts. And this is another resource that I can drop in the chat for folks to take a look at. The other great thing about the Core Consensus Project is that it does have additional resources. They have some job descriptions. Maybe you're going to do a mixed sort of hiring process where you directly hire as well as contract with community-based organizations. And this can be another really great place to start and find additional resources. Next, it is important to include data collection and evaluation as part of those activities within the scope of work. It's really important to be able to tell that story of the great work that you are doing as the public health department, as well as in partnership with community-based organizations. And again, we want to give folks some tools to think about what are some of those key common indicators that you might want to include in evaluating sort of a CHW program you're contracting in. So again, I want to give a shout out to another great national organization that works with community health workers, now the Center for Research and Evaluation, who developed the common indicators. And again, this is really a set of tools around evaluating CHW programs. It touches on both sort of making sure CHWs are respected and protected in the workplace, as well as just as this program sort of effective. Again, they have some resources, some really hands-on tools, and they can be just a really great place to start if what you're looking for is some help with that programmatic evaluation side. And next, I want to talk a little bit more about funding and partnering with community health worker networks as advisors, trainers, and advocacy partners. Folks on this call may or may not already have relationships with CHW networks. There are CHW networks at the state and local level from across the country. As I said before, they are doing things on a variety of levels. Some of them are working on state certification or maybe Medicaid reimbursement. They're working to bring folks together across the country who are allies and CHWs themselves and host conferences. Many of them are now also starting registries or have really robust websites, just to give you a taste on sort of the range. But everything, it really does depend on different states. Each state sort of looks a little bit different in their CHW infrastructure, as well as the infrastructure of their CHW network. We at NACHW really want to make sure that we are enabling connections to state CHW networks, as well as getting some tips on ways that you can partner. We really recommend connecting with them early and often as you develop your sort of strategy on how you're going to engage CHWs. And they can also be a really effective sort of recruiting partner for you. Again, whether you are looking to build partnership with CBOs to hire CHWs, or you want to directly hire, those CHW networks already have relationships with CHWs who are already trained, and can be a great way to connect with some of those folks. I also want to recommend NACHW's Document Resource Center. This is the largest single source database for CHW research and policy, and it has documents from across the country on what partnerships CHW networks have had with their state. This can vary from how did a certain state get CHW reimbursement with Medicaid passed, or how did they establish their state association, and much more. So this can be another great resource to, as you're looking towards your own state infrastructure, or looking to build partnerships with the networks. And lastly, again, if you're sort of new to the world of CHW networks, I recommend this website from NACHW. It goes through and it really gives a summary on sort of what's going on in each state in the terms of CHWs. It'll include whether or not there is a CHW network, if there is some kind of reimbursement for CHWs and how that's done, whether that's an 1115 waiver or a state plan amendment. And it really gives you, it's a great starting place if you're sort of new to this work. So I will drop those links in the chat. Okay, next I'm going to talk a little bit about some of our recommendations in terms of funding organizations equitably for their work. The first thing that we talk about, and it's something that we hear a lot, is that we want to encourage you to invest in this CBOs and CHW network sustainably whenever possible. And when you can't invest, make sure start investing time into building long-term partnership. And here are some resources in terms of learning a little bit more about what this looks like. We know that community-based organizations, they're largely funded through grant funding, and that can make it difficult to hire folks sustainably and maintain those relationships with communities. So whenever possible, developing those long-term relationships. We're also including something from PSTAT, which is a program sustainability assessment tool. This is a really great program to use to sort of gauge your own sustainability in your own CHW program and can give you some additional resources and recommendations in terms of sort of where to go next in building your own sustainable plan. The other thing I'll say is because sometimes public health departments are dealing with the same issues that CBOs have, and that there's not always funding available to continue that partnership. Some things that you can do to continue to uplift the partnership is just talk about your successes and let folks know that there was a partnership and that it went well. We've talked to CBOs across the country, especially throughout the COVID-19 pandemic, and they have really appreciated and have been able to use some of that leverage in order to apply for additional funding. So even just sort of documenting your success and communicating with the public about it can help CBOs build their own sustainability. Next, as NACHW, we always want to make sure that we are lifting up that CHWs have what they need to serve their communities. And one important part of that is ensuring CHWs receive a thriving wage. Through our 2021 national survey data, we have found that CHWs report a lot of inequities with their pay, and we can see that over different races and ethnicities. We know we get a lot of questions about what do sort of thriving wages look like for community health workers, and that's really going to vary from state to state. So we also want to provide a couple of different resources to help sort of determine that. One on the right is actually some standards that Massachusetts has been working on for the last few years to establish some standards in their community health worker pay. And that gives some concrete dollar amounts in terms of what they are paying their CHWs. And then on the left, you can see the MIT living wage calendar. And this really gets down to some of the nitty gritty of sort of what it costs to really have a living wage across the country. And that can be another great resource in terms of building that into your contracts with CBOs of what's going to be realistic for them to hire or maintain a CHW within their program. Next, I want to spend a few minutes talking about the importance of building upfront funding into contracts. Often what we've heard as we have worked to grant out to community-based organizations and we have elicited feedback about CBOs experiencing working with organizations is that it can really make a huge difference for grants to give CBOs a little bit of upfront funding. This allows them to purchase materials for the grant, to continue paying their employees as they wait to finish some of those deliverables, and can really help with their overall sustainability. We also really recommend, if whenever possible, including an indirect rate into the contracts. This again allows CBOs to continue all the great work that they're doing. Sometimes public health departments and CBOs sort of forget about all the other aspects that can take to run an organization that might lie outside of the direct deliverables, things like maintaining a physical address, doing your contracting and financing, all of those add up. So whenever possible, we really recommend including an indirect rate. And then we also want to introduce this idea of using value-based payment. And this is sort of a new idea that has popped up in the last few years that really talks about when you're doing social determinant of health work, when you're sort of aiming to work on some of those upstream equity issues, how can we really make the case about that value? Often in our health system, we place greater value once folks are already sick, but how do we make the argument that it is really important to put the money up front before folks are sick to make sure that they are having their additional needs met. And that is really what value-based payment is all about. And here are another couple of great resources about both value-based payment and working with CBOs. This one from value-based payment really goes on to sort of what that is in theory, and a little bit about how you can sort of add that to a contract. And then on the left, this is a webinar we did with some of our partners, such as Health Begins, on having partnerships with CBOs and healthcare organizations. But a lot of it really does still apply regardless of the type of organization you're working with. One of our last recommendations here today is making sure that when you're putting together these contracts and scopes of work, to include funding for technology, transportation, supervision, materials, and supplies. For some of you, this might seem obvious, but often CBOs report that during these sorts of contracts that these different aspects of delivering services to communities can often be overlooked. Often folks are really looking just towards the hours the CHW works or maybe to the deliverables, but we want to make sure that folks are remembering all the other aspects it takes to really deliver a robust service. And this might be the platform that's used for data collection, how CHWs are getting around to do that community work. We always do encourage that CHWs are receiving appropriate supervision, and that work should also be paid for within the contract. And these are important for the sustainability for CBOs or CHW networks you're working with, but it's also important in terms of making sure that the delivery of partnership and services to community is excellent, is making sure that CBOs have all that they need to achieve the contract deliverables. And lastly, we want to make sure, and I've mentioned this a couple times throughout the presentation, is that we know that there will be times that funding is not available or that there are certain boundaries to contracting with certain CBOs, but we want to make sure that that doesn't necessarily get in the way of starting to build relationships. And we really saw that this play out through the course of the pandemic, is that public health departments that already had relationships with community-based organizations were able to more quickly mobilize folks in their community and more easily able to contract with CBOs once they had funding available. And here we have, again, a couple of different resources in terms of creating and maintaining partnerships. First is called the Community Toolbox, which is a resource from CDC that's all about sort of building partnerships with community. The second is really about health justice. It's from the Bill of Health, and it gives some great recommendations on how to build organizations, and again, some thoughts about how to do this work really equitably. And then lastly, we have another resource from CDC about community clinical linkages. And again, how to sort of structure that work and making sure to build partnerships that last throughout many decades. So again, you're able to more effectively ramp up. And now I'm coming into the last sort of 5 to 10 minutes of my presentation, where I want to make sure that folks have opportunities to continue to work with us. And then we'll move into Q&A. I see folks are starting to put things in the chat. Please do as I'm wrapping up. We'll probably have a nice 15 to 20 minutes to do Q&A. But before that, I do want to let folks know that if any of this is interesting to you, or if at the end of the session there are questions I haven't answered yet, that NACHW is a national partner providing TA with NNPHI through FIVE, the TA portal. If folks are interested in working with us or interested in any of the resources today, please feel free to give us a shout out, and we can likely schedule another follow-up meeting with you. And as part of that, NACHW was also putting together some proactive work, like the presentation today, as well as the toolkit that we're going to be sending out with all of these resources and more. A couple weeks ago, we also had a presentation that was around strategies and principles to developing community health worker workforce studies. That will also be available soon. That's a really great resource for folks who are really interested in collecting data on the workforce. And I can share that out as well in our follow-up. I also want to give a shout out to our annual Unity conference. This conference is a national conference that's actually been going on for decades before NACHW was founded. When we came together as an organization, we were sort of gifted the Unity conference to continue on. Last year, we held our first in-person conference in Austin, Texas. We'll be doing a virtual conference this year as we ramp up for an in-person one in 2025, and that'll be on August 21st and 22nd. Another great opportunity to get some information around community health workers. There'll be trainings for allies and community health workers alike. If you're interested in learning more about different aspects of the profession, or to hear some sort of case examples about what our different programs doing across the country, that's another great option for you. And again, if folks found these resources helpful today, we do have a free newsletter that you can sign up for at NACHW.org. Folks can also feel free to follow us on social media. We are on sort of all the traditional platforms. So before I wrap up today, I do want to say we have plenty of time left for questions. I see someone already threw something in the chat. Thank you so much. Christian, I see, let's see, this may also be included in some of the resources, but do you have any resources on how to effectively monitor and manage CBOs that we have contracted with in terms of financial oversight, ensuring program metrics are met, etc.? That's a really great question. Some of the resources that we share do go into some of the more nitty-gritty of that, and I can highlight that in my follow-up. I definitely think some of that can also be accomplished in terms of building that partnership in with the CBO to make sure that you have that trust and that mutual understanding of sort of how CBOs are going to keep you updated. And also at times around, there might be a little bit of a need for some TA for CBOs, especially if there's somebody who hasn't necessarily worked on government contracts before. Because if you're having issues with either financial oversight, sometimes it's just about making sure that expectations are set and that folks know that they should be updating you every so often and providing paperwork this way. So you might need to do a little bit work up front to provide some of that TA, but it can be worth it in terms of having the CBOs sort of run the programs themselves. Christian, let me know if you want to voice over any of that comment or anything else that I can help with.
Sure, thank you. That was helpful. This program has been implemented for a few years now, so we're always looking, for process improvement and things like that. So with my role, I'm more so with operations and like oversight of the CPOs in a way with the financial component. And so I just wanted to make sure that we're still ensuring that, there's equitable practices, but also letting them do what they do with the portion of the community that they work in, but also strengthening our oversight in a way.
Yeah, I think that's a really great point, and I think you have exactly the right mindset. I think it can always be worth at the beginning of a grant to have a meeting where you really set the stage and you sort of walk through things. Sometimes even just sort of making assumptions that folks are comfortable with certain things can lead to sort of issues down the line. So taking the time at the beginning for that can really be helpful in terms of setting expectations. But otherwise, really happy to hear that you're already thinking about sort of equitable processes. Really great to hear that. I'm looking for one other resource to send you. But while I look for that, if folks have other questions, if they either want to come off of mute and ask or drop them in the chat. In the chat, I'm also going to drop another great resource that we have used. It is around some contracting do or don'ts. This is also included in the Health Begins Toolkit, but this really gets down to some of the more nitty gritty in terms of sort of what to include in a contract, what are sort of different contracting language might mean. And that can be really helpful in terms of sort of determining what type of contract you want to do. So definitely recommend that. Drop that link in the chat. And again, the slides, all the links are going to be sent out to you as well after the presentation. Okay, I'll give it one more minute if folks have questions that they either want to come off mute or drop in the chat. Thank you, Christian. I'm so glad this is helpful. Okay, well, if not, then I will wrap up for the day. Thank you all so much for coming and engaging with us and wanting to build partnerships with CBOs and equitable relationships with CHWs. I hope you found this helpful. Again, if you guys are interested in having a one-on-one or follow-up conversation, maybe you're interested in an introduction to your CHW network, feel free to shout NACHW out in 5. And NNPHI will help connect us. We do have a very brief post-webinar evaluation, and I will drop that link in the chat as well. Or if folks would like, we have this QR code here. And this just helps us to determine what other proactive TA we're going to do, as well as get a feel for if this is helpful. And we'll also be sharing out the full sort of toolkit with you in a few weeks.